This standardized patient encounter was probably one of my favorites, mostly because the pathology that the patient possibly had was something that I was quite familiar with as far as symptoms, signs, and medication use. Good things that happened. I am fairly proud of my patient education in this standardized patient, just because, like I said, I'm familiar with the situation at hand, and I felt like the patient kind of understood where I was coming from. I got them to calm down a little bit before I left, and I felt like it was a good flow through the eval. More or less, I just love the patient education aspect of all athletic training, but this standardized patient really helped me project that out more. When it came to things that didn't go as well, I'd have to say, for one, the SOAP note writing. It's kind of hard without writing things down during the eval to remember exactly everything, but that's not really a big issue yet. Other things that could have gone better, getting the patient calmed down in the beginning. That was a little rough at first. I didn't ignore it, but I went straight into the eval rather than thinking about let's get the patient calmed down first, which me having asthma as well kind of helped out knowing what it was, so I didn't think it was as serious. But I was able to get the eval done and get the patient calmed down, taught them some techniques for breathing to help calm them down. I feel like the questions that they asked were something that a real life patient would ask me, and I think I answered those fairly well. The tingling in the hands kind of got me, but that's just a sign of hyperventilation anyway. Overall, this was a really good experience. I know I'm going to see a lot of this in the field that I want to be in, especially with high school students. But it was a fairly real life scenario, and I know this will help me a lot in the future.